Hi, my name is Greg Bolan. I am chairman and founder of Another Way Recovery Services, and I'm pleased to have with us today our Chief Medical Officer. We are an at-home detox and recovery services operation, authorized to perform our services in Tennessee, North Carolina, and Georgia, and we are quickly winning new commercial insurance contracts, especially in Tennessee, and moving on to Georgia and North Carolina. And Dr. Hall, I'd love the audience to hear a little bit about your story and what you got, what intrigued you about addiction.
I'm Dr. Jonathan Hall, and thanks for the introduction, Greg. I was a family medicine physician, and I ended up getting an X waiver to be able to prescribe buprenorphine for the treatment of opioid use disorder while I was in residency. And after I finished with residency, I thought I should probably do something with that degree. And so I ended up as a volunteer at a community health center in Asheville, North Carolina, spending some time actually treating people with opioid addiction. And I found that it was a lot more rewarding than I thought it was going to be. And so with that, I was able to just continue to treat addiction in addition to the things that I was doing for my regular salary. And it's just been a very fulfilling goal, and I've been able to make that my full-time employment.
That's great, and our hat is off to you. It's a very difficult illness to treat. I believe in 1987, the American Medical Association did in fact define addiction as a chronic disease or incurable disease. So as you think about that as a provider and wanting to help your patients and obviously increase the effectiveness of treatment and the longevity of sobriety, can you talk about what modalities on the medical side that have come about in the recent years that is helping to prevent relapse or at least reduce relapse rates? And we can go from there.
Addiction is a kind of a difficult to define condition, but it is more or less a chronic condition if we think about addiction in terms of other health issues. And what makes it chronic is that people tend to resume use because access to a substance or a behavior that may be the problem substance or behavior is just so accessible. It's very easy for people to get whatever it is that they were doing. And because of this, people can resume it quite easily. We have really great treatments that work very effectively. In medicine, I don't think a lot of people understand that what physicians or providers are actually doing is trying to manage risk and reduce risk. And when I speak about risk, if we think about a disease like high blood pressure, nobody really cares what number is on a blood pressure cuff. It doesn't really matter what that number is. The reason that we care about those numbers is because when it gets quite high, it increases the risk that somebody might have a stroke or a heart attack, and those types of issues can really reduce a person's quality of life.
Sure.
And so we don't care about this number, we care about somebody not having a heart attack, not having a stroke.
Of course.
And in addiction, we want people to be able to live life on their terms. We don't want them to have to use a substance or have to engage in a particular behavior. We want them to be able to do what it is that they want to do.
Sure.
And most recently, we've had a lot of changes in where a lot of the drugs that people are using recreationally are coming from. And it's started to have some of these quite dangerous fentanyl-like analogs when we talk about opioids.
Sure.
And that's made addiction a very dangerous condition to have currently.
Absolutely.
It's kind of gone from where people aren't just managing, they're actually trying to avoid being sick, and when they do that, they could end up with a substance that is so deadly that the first time they use it, they might not ever have a chance to recover from that. It could be deadly. Absolutely. Immediately.
Of course.
Yeah.
As a person in recovery, I would often be asked the question, why can't you just stop? And I never had a good answer because I didn't know. I really wanted to stop. Even when I didn't want to drink, I would drink because I would get sick if I didn't. And I didn't like that feeling, and I wanted to numb it out, and I wanted to numb out, kind of the emotional pain that I felt. And so as we think about the transition from medical to clinical, so that continuum of care, what would you say, this is really a lead into our service, which is at home versus traditional treatment centers. Where do you think the system is? Because we've seen relapse rates now, we believe, to be above 70%. And I think some of that has to do with the influx of fentanyl and more addictive substances. But alcoholism, addiction to benzos still continue to be a huge issue. Where do you think at home comes in as potentially a superior, efficacious treatment setting or modality than that of traditional treatment?
I think if you look at the relapse rate, whether it's from an NIH statistic, whether it's from sort of industry statistics, or I just read a 2019 paper by the VA which put relapses at 3 months within about 65% for veterans who were struggling with alcohol use disorder, and as high as 85% at 12 months. So wherever we look with these numbers, if it's 40%, if it's 60%, if it's 70%, there's a lot of room for improvement there. Absolutely. And I think currently there aren't any service providers who are bringing a lot of the medically supervised detox into a patient's house.
That's correct.
And what I think the advantages are offered there is that, one, a person is actually in their environment. This is the environment where most likely they've probably been abusing a substance. And it's also the environment that seems to trigger this person to, go back to using. Sure. And so I think that that's going to be potentially a huge improvement over what happens with the traditional either inpatient or residential treatment models. Sure. Looking at allowing somebody to start to process and handle a lot of the stressors and the triggers that they've previously been triggered by. Sure. is going to be very beneficial. One of the terms that you've introduced me to is the treatment bubble.
Yes.
Being able to potentially burst the treatment bubble is maybe going to be the best thing that we can do with at-home treatment.
Yes.
The treatment bubble. This actually is a term or slang that we do use internally in the industry. I don't know that there are any white papers that are written about it yet, but what I found and what I have found, obviously having met hundreds of people in treatment and outside of treatment, is that when a person is institutionalized, the saying is no one really goes to treatment on a winning streak. And so it's just kind of an internal dry joke, but it's very real. And so when that individual is institutionalized, they are leaving behind a lot of damage. Burn bridges with friends, loved ones, spouses, coworkers, you name it. And so when an individual does enter a typical detox residential program that lasts, say, 24 to 28 days, they, of course, are then released, and of course there's the option of intensive outpatient or partial hospitalization, otherwise referred to as PHP. But the bottom line is that individual is, once they're done, they may have made a lot of progress at the facility, but once they get back into reality, there's a lot of remorse, there's a lot of regret. Obviously, there's a lot of anger typically towards the patient. For me, I would have severe panic attacks several days before discharge because I knew
what you were going back
what
to.
I was going back to. And oftentimes I was right, and it would just lead to yet another relapse. You can obviously acknowledge the fact that you have a problem, But once you accept that you have a problem and that it actually is a disease, and having outlets like of course what we offer here at Another Way Recovery Services, once you exit detox, you are immediately, if you desire, you enter our phase 2 program, which is a 3-month intensive telehealth, telemedicine program where the patient does receive counseling 4 times a week for 12 weeks. Sounds like a lot, but I can assure you when they're in the real life setting, that amount of treatment is necessary because they will encounter relapse triggers and we have to be there for them 24/7, in fact, should they have a trigger that occurs or should they relapse. And we try to lessen the impact of the relapse through different types of intervention. We are, of course, there for them on the, at their convenience every day. And I think another huge benefit of our program is we do practice family counseling with and without the patient. Family members can be both a trigger, but they can also be a wonderful support system. My young son obviously is a huge motivation for me to remain sober because I know that if I pick up, I may not come back.
You're going to be jeopardizing that relationship?
Yes, that would be obviously terrible. What I've found with this disease is that it is progressive, it is incurable, and it is ultimately fatal. Unfortunately for me, I nearly met the latter, the fatal piece, and that really opened my eyes. I am getting text all the time about friends that I had developed in treatment in our cohorts, and seeing their obituaries in these group texts over my time, and I just thought to myself, there's just got to be another way. Hence, the beginning or the onset of Another Way Recovery Services. And a patient who comes to you and says, Dr. Hall, I am in bad shape. I can't even sleep at night. What's your kind of initial response to them?
Somebody coming in with severe withdrawal.
Severe withdrawal, or that of someone who really wants to get better, who wants to quit. How do you, as a medical professional, how do you think about, okay, what are the steps that I'm going to take to kind of get them started?
So thankfully, my job is kind of easy with this part because the detox portion of getting somebody from, say, an unstable position into a more stable position where they're not dealing with the acute withdrawals, that's not too difficult, medically speaking.
Yes.
We do have medications that are incredibly effective for that transition for alcohol or opioids. And we can make that happen with a fairly high degree of comfort. I'm not going to say it's all roses, but usually we can get people through that phase pretty simply. I think, what I can do as a medical provider is I can provide some medications which can greatly enhance the chance that a person is going to be successful in their recovery. And these medications, basically speaking, if I can treat 2 people either with alcohol use disorder or opioid use disorder, which are kind of the most common conditions that I end up treating, I can get one of them on average to remain in recovery for 12 months, which is huge. And so, from my perspective, what I can do is keep somebody on maintenance treatment and highly encourage them to work with some of the behavioral or clinical side of things, whether that be, with counseling, IOPs, frequent meetings, whatever their particular source is, encouraging them to do that and basically put into place some of these relationships that they had before they developed their relationship with this substance or the behavior.
Of course. And And I would add to that, to be very clear about Another Way recovery services, as research has grown, I guess, just intellectual affinity towards the disease has increased among medical professionals such as yourself, our clinical personnel, our psych nurse practitioners, family nurse practitioners. It's become abundantly clear that with substance use disorder, there typically is a co-occurring mental health condition. You can draw a nice Venn diagram between the two, typically. Thinking about the maintenance drugs that you're referring to, can you talk a little bit also about addressing the patient's mental state and how important it is for compliance with psychotropic drugs that, maybe anti-anxiety, antipsychotics, what have you, antidepressants, and how important that is to remain compliant?
Yeah. So anything that's going to benefit or improve a person's mental stability is going to tremendously enhance their ability to remain in recovery from a substance or a behavior. Whatever particular combination of medications or therapy modalities are going to be effective is going to vary from person to person, but whatever we can do to stack the odds in favor of a person remaining in recovery should be undertaken. And we do know, like you mentioned, that a tremendous number of people, a much higher degree of people who end up with addiction are people who are suffering from co-occurring mental illnesses that could be completely separate from addiction.
Of course.
It gets a little bit tricky because all of these ideas are just models.
Of course.
There's, as we're talking
Venn
about,
diagram.
there's no brain scan that we can give that shows like, oh, this person is addicted to alcohol, right? And so, we don't have that sort of a definitive. We just sort of see it through people's behaviors, and a lot of psychiatry, mental health tends to just work on we're observing somebody's behaviors as opposed to looking at a image and saying there it is.
Yes.
Yeah.
It is unfortunate that it's really the only medical profession where you can't just go in and get a scan and say, oh, you've torn your rotator cuff. We'll just do surgery, I'd also like for us to talk a bit, and I know this delves into the clinical side, but Alcoholics Anonymous, Narcotics Anonymous, obviously there are quite a few groups out there. AA, of course, being the oldest, going back to the 1930s, and has helped many people get through the toughest part, which is typically the first 6 to 12 months, although relapse occurs at 10 years. I've seen it many times. But it doesn't work. It has not worked for many people. So what we've tried to do is, obviously, we can practice the classical 12-step method with our patients. That's why our program is so, I believe, effective, is because it is individualized. And we're not sitting there talking at you, 80 guys in a residential program at a treatment center, about how to prepare your fourth step. This is the way. Well, there are other modalities that have come along, like cognitive behavioral therapy, DBT, even smart recovery is worth a look for some. I do think that it's very important, and this is more of a statement than it is a question, it's very important for people to understand that, yes, community and having a support system in a program where people understand you can be beneficial. However, many people just are not.
Doesn't work.
It doesn't work.
Yeah.
And that's why when we hire our primary counselors, for the audience who's listening, we are looking for counselors who are always studying the latest and greatest cutting edge research as it relates to treatment modalities. But we always, of course, offer the option, or at least even try classical 12-step model. But again, many folks do not respond to it because they try to, of course, define it as a spiritual program, but it's hard to define it as a spiritual program when I think God is mentioned about 284 times in the first 164 pages of the big book. So people, of course, are mad, at God, and whether it's justified or not, who knows. But we try to kind of avoid any type of modalities that might make our patients upset or potentially even non-compliant with their counseling sessions. So it's very important for folks listening to understand that we are very well diversified in terms of which modalities will fit that individual the most.
Yeah, and able to be personalized. And
Absolutely.
So nobody's going to end up being pigeonholed. Nobody has to do this particular thing. There's paths that are going to work for the patient. And I like that because as long as I think a patient comes back, keeps showing up, and is continuing to work, I think that's the most important factor in somebody being successful in recovery.
Sure.
Is just, you got to show up if you're going to be successful.
Sure.
Yeah.
Another thing that we are really trying to do as a company, as it relates to our services, is offer it at a cost-effective way to the insurance company, and obviously a longer-term continuum of care than that of what traditional treatment can offer, and that, I think, has really excited the payers that we're dealing with, and hence why we have really gained momentum in our in-network coverage with commercial insurance companies. There's obviously, of course, typically an out-of-pocket deductible. We understand that. We can work with you on that. But understand that, having insurance cover this type of treatment is a huge benefit to a much larger population than, say, a private pay solution. Yeah.
Yeah, and even I think comparing to a private pay solution, I think another way recovery services is still going to be much more affordable.
Much more.
Yeah.
Yes. Our cost, at least on a private pay basis, is at least 50% cheaper. I think insurance companies are recognizing that, and we do that. There are several ways we can do that. Of course, we're not going to, just as my mother wouldn't share her secret recipe for lasagna, we're obviously not going to share that on camera. One other thing I'd like to just delve into is, what are your kind of near-term, intermediate-term goals in terms of getting more involved in the treatment of addiction?
Currently, I'm going to be getting my addictionology certification. There's an exam in October that I'll be able to sit for and take, and so getting some credentials to become more official. I've been doing this for about 5 years, and so it doesn't feel like the credentials are necessary, like it's been my life, but you always like to have the right letters behind your name.
Of course.
And otherwise, I think some things that are really fascinating to me is I think I would like to learn a lot more about the jail and prison systems in our country. For whatever reason, we've criminalized addiction.
Yes. And
so a lot of people who are struggling with what I do consider, and I think that probably in short order, our society will come to understand that this is not a disease of choice. This is not something that people choose to wake up and have these unhealthy relationships. Right. It's something that some people are more susceptible to, and it's not something that they choose. So, I would like to see that we could improve treatment options for people who end up incarcerated. So that's also something that I'm very interested in, as that's where a lot of people with addiction end up being, just due to the nature of their
It's very unfortunate. And in fact, I would say that some states have actually really stepped up their game, whether it be in-house drug program where they enter, I think it's typically an 18-month program while they're incarcerated, In fact, many of those folks exit prison and become recovery coaches at treatment centers and are wonderful people, very insightful, because they have immersed themselves in whether it be the big book or some other type of modality. But so I hope that in the future we will see other states step up funding for for that type of treatment in-house before they re-enter society.
I think it's inevitable. I mean, I think we have to. I think it's just not tenable to continue with that. We can't continue to treat what is a medical condition and say this is again it's against the law for you to have a medical condition.
Right.
But it's something, and as a society, I do feel like we can do that. We've done it before. We did it for schizophrenia. I think even before that, when people have epilepsy, 400 years ago, if you had seizures, that meant you were out cavorting with the devil. And so the way to treat somebody with epilepsy was to burn them at the stake. Yeah, and so you can kind of see, that was where we were 400 years ago. Now we understand, hey, this is a medical condition. We have medications that can be effective. Kind of the same process went through with schizophrenia as well, autism. There's a lot of conditions which have really been looked at as sort of like diseases of choice or diseases of parenting or what have you. Yeah. And now we fully understand, hey, this is a medical issue. This is something that nobody chose, and I think we will get there. But
there is absolutely, and I can speak from experience, a stigma on even folks who have been in recovery for years. I try to stay away from it when I'm just in general conversation with strangers, but I'm not down on myself or feel inferior to others because of the disease that, for whatever reason, it has afflicted my brain and my way of thinking. But there is a huge stigma out there, and I hope that if anyone gains anything from this conversation between myself and Dr. Hall, is that this is not a disease of choice. This is a true disease, and it's incurable. However, it can be arrested, and we can do it obviously through medication and obviously maintaining, but of course maintaining compliance with that medication is crucial. And I think also on the therapy side, where we can use multiple modalities and be there for you 24/7. Especially through our Charlie app, which we haven't spoken about. That's a whole nother conversation for another video that we developed where patients can reach us 24/7. Well, Dr. Hall, thank you so much for your time. We obviously are honored to have you as our Chief Medical Officer. We, of course, have other medical personnel who work for us, and of course we look forward to your guidance, especially as you move into the addictionology field. We'd like, really through these videos and through our constant hammering of social media, we're really trying to increase consumer awareness that, hey, at-home detox and recovery services is completely legitimate, it's completely legal, and we are licensed to do it in the states of Georgia, Tennessee, and North Carolina.
More states coming soon.
And more states, yes, to be announced. We will absolutely be expanding. I think consumers are increasing awareness. And then as it relates to providers, if there are some listening, if you're not, that's okay, because soon enough we'll have business development personnel in your offices and we'll be definitely putting this in front of you. And I think increasing provider awareness will translate into increased consumer awareness. So thanks again for your time. And
for providers, if you're trying to find a treatment option for people who have a professional schedule to maintain, might not be able to spend 30 to 60 days in a facility, this is a great option. I mean, this isn't an excellent option, and I think it'll be at least as effective. I think it's going to be superior to our conventional treatment models, and so this is an exciting service that we get to tell you about, which is a lot of fun.
Sure.
Yeah.
Thanks so much, Dr. Hall.
All right. Thanks, Greg.